Hello, and welcome to the Saline Weight Loss Center. We're so glad you're here to learn about weight loss surgery. I'm Chelsea Toll, and I'm the bariatric coordinator here at Saline Health System. That means if you have any questions at all, I'm here to help. I'll be here every step of the way in your weight loss journey to ensure that you have the best care. I first want to introduce you to your weight loss team. As part of our program, we have 4 wonderful surgeons: Dr. Rex Luttrell, Dr. Kristen Patton, Dr. Lewis Porter, and Dr. John Salem. In addition to our weight loss surgeons, we also have a whole team to care for you, including a dietitian, cardiac doctor, sleep study physician, psychologists, nurses, and more. Actually, as a part of our commitment to your weight loss, we've trained every staff member at our hospital on how to care for our bariatric patients. We are even one of the only bariatric accredited facilities in the state. That means anywhere you are in the hospital, you'll be greeted by someone who has been specially trained to care for you. And as part of this accreditation, more insurance companies will cover bariatric surgery at Saline than at non-accredited facilities. Now, to get us started, we're going to have Dr. Kristen Patton tell us a little about the social and economic effects of obesity.
In the U.S., 1 in 3 adults are obese. This major health crisis has some serious effects on Americans, both socially and economically. From a social perspective, people who suffer from obesity tend to feel the effects of a social bias or discrimination. Rather than feeling sympathy or compassion, people tend to act judgmentally towards people who are obese. In addition, patients suffering from obesity also tend to suffer from other illnesses and experience premature aging. From an economic perspective, obesity has a direct impact on the U.S. healthcare system. In 2008, an estimated $147 billion was spent in medical costs for obesity. If obesity trends continue, it's estimated that related medical costs could rise an additional $43 to $66 billion each year by the year 2030.
Thank you, Dr. Patton. Let's now take a deep look into the obesity trends over the past couple of decades. Dr. Lewis Porter is going to help take us through these statistics.
Unfortunately, in the United States, obesity is a major problem that is growing. Let's dive into some of the statistics to show you the specifics of this crisis. The first map shows the number of Americans in 1994 who suffered from obesity. The next one shows the same data for 1999. You will see that in just 5 years, we went from having no states in the red to nearly half of the United States being above 20%. From there, you will see in 2005 where nearly the entire United States is in the red and 2 new categories were added. To sum it up, you are not alone. The obesity crisis in the United States is widespread, and along with these high statistics comes significant increases in mortality rate among Americans. Here are some of the facts about the relationship between obesity and the mortality rate. Obesity worsens health and quality of life and shortens life expectancy. A recent study concluded that obesity in adulthood is associated with a decreased life expectancy of about 7 years in both men and women. After smoking, obesity is the second leading preventable cause of death.
Thank you, Dr. Porter, for sharing those statistics with us. Next, we're going to ask Dr. Rex Luttrell to tell us about what influences weight gain and how obesity is determined.
Weight gain and obesity are the result of a combination of influences, including the types of food you choose to eat, behavior around your eating patterns, and your metabolic rate. While food selection and eating behavior are easy to control and monitor, metabolic rate is much harder to control. However, it is affected and can be somewhat controlled by diet and exercise. Now let's talk about what exactly morbid obesity is. Clinical morbid obesity is the point when serious medical conditions occur as a result of obesity. Clinically, it is diagnosed when the patient is more than 200% of their ideal weight, is more than 100 pounds overweight, or has a body mass index greater than 40.
Thank you, Dr. Luttrell. Now, before we move into treatment options, Dr. Salem is going to tell you about some other obesity-related health risks that you could be experiencing.
Some of the common health concerns that are often related to obesity include diabetes, hypertension, hyperlipidemia, metabolic syndrome, heart disease, sleep apnea, PCOS, cancer, gallstones, urinary incontinence, reflux disease, degenerative arthritis, venous ulcers, depression, joint problems, low back pain, infertility, DVT, and asthma. Based on your BMI, if you fell into the categories of severe or morbid obesity, your risk of experiencing these serious medical problems is greatly increased. However, keep in mind we are here to help you. We want to not only help you meet your weight loss goals, but also help you live a healthier life overall.
Now, what you've all been waiting for, we're going to have our surgeons tell you about some of the treatment options we provide here at Saline Weight Loss Center.
One of the most commonly requested procedures is the non-surgical Orbera balloon. This procedure is a new incision-less, non-surgical option that gives you the momentum you need to amplify all of your weight loss efforts. The Orbera procedure places a small balloon in your stomach that fills about a third of your stomach, helping you feel fulfilled after eating. The procedure takes about 20 minutes and only requires mild sedations and allow you to go home the same day. The first week with Orbera will be challenging. Patients should expect to feel sick the first 3 to 5 days. In some patients, the symptoms may last up to 2 weeks. Medication will be prescribed to help you address these symptoms, and our support team is always here to help. As with all weight loss surgery, your effort matters. Orbera provides a boost to lifestyle modification. Patients' adherence to the diet and exercise program will impact the outcomes. Success with the balloon leans heavily on the patient keeping appointments with the bariatric dietitian, surgeon, and attending support groups. While Orbera does not require surgery, any medical procedure requires careful thought and consideration. To qualify for Orbera, you must be an adult, have a BMI between 30 and 40, be willing to participate in a medically supervised program.
Let's first talk about who is a candidate for bariatric surgery. In order to qualify for surgery, one must meet one of the following criteria. Meet the National Institute of Health criteria, that is 100 pounds over ideal body weight, a BMI of greater than 40 or greater than 35 with at least 2 comorbidities. You must be over the age of 18. You must have failed medically supervised weight loss attempts, have acceptable operative risk as it relates to the patient and the procedure, have no endocrine cause of obesity, and be dedicated to the lifestyle changes and follow-up.
At Saline Weight Loss Center, we perform 4 surgical procedures to treat obesity. These procedures include gastric bypass, sleeve gastrectomy, adjustable gastric band, also known as the lap band, and the overstitch. Let's begin with discussing gastric bypass. Advantages of the gastric bypass are that it provides excellent appetite control, rapid initial weight loss, better reflux control, and less malabsorption than duodenal switch. It also helps control type 2 diabetes and has a higher success rate than the sleeve gastrectomy or the adjustable gastric band. Some disadvantages of the gastric bypass are that it is non-adjustable and a portion of the digestive tract must be bypassed, which can result in nutritional deficiencies. It may also affect the absorption of certain medications. Next, let's discuss the gastric sleeve. The sleeve procedure can be done laparoscopically and more than half of the stomach is removed, which leaves a thin vertical sleeve about the size of a banana. Research has shown that people that have this procedure do lose more than half of their excess body weight. However, this procedure is non-reversible and there are risks including a leak after surgery and poor nutrition. Patients must be committed to taking vitamins for the rest of their life, and there is a very small risk of dumping syndrome.
The third procedure we will discuss is the laparoscopic adjustable gastric banding, also known as the lap band. The procedure is statistically the safest bariatric surgery available today and has proven to provide gradual but steady weight loss. You will have multiple appointments with your physicians and he or she will be able to make adjustments to the band in the office. Limitations of the gastric band include slippage of approximately 5% versus 1% erosions or less than 1%. More frequent adjustments and is not as strong as a tool for diabetes.
As you can see, we have a variety of options for patients needing to lose weight. However, regardless of the procedure you choose, we provide the follow-up care you need to successfully meet your goals. Follow-up care for procedures includes a nutritionist to create a diet plan that's right for you, regular exercise as advised by a physician, behavioral counseling and therapy as needed for weight gain, follow-up appointments with a physician, which is specifically important for band patients who may need adjustments. It's important to keep in mind that any surgical procedure can result in disappointing results depending on multiple factors. But the most important thing we want you to understand is weight loss surgery is a tool, not a fix. We're here to help you use your tool in the most effective manner in order to achieve your goals. Now, if you're ready to get started toward a happier, healthier you and join our team of weight loss warriors, we're here to help you. To start, contact us at 501-574-7171 to schedule an appointment for consultation. Before that appointment, you will need to request records and a letter of recommendation from your primary care physician. If you have any questions at all, please give us a call at 501-574-7171 or email me at chelsea.toll@salinememorial.org. We look forward to hearing from you.